Hello everyone, I'm Dr. Pranshu Mehta and welcome back to the E.N.T Surgeon Presents Aesthetic Medicine and Injectables. Okay, so today's class is our third lecture. We have already done with the first and the second one. The ones who have not seen the first and second lecture, kindly go through the lecture 1 and 2 before coming to this so that you can understand this lecture. They're available on YouTube, the E.N.T Surgeons channel. Okay, so this is lecture 3, Facial Aesthetics. Now, this topic, as you all know, like this lecture is about Botox or the botulinum toxin. Now, sounds interesting, isn't it? The Botox, we have heard it since we were kids, that the actresses they go for Botox injections and they become pretty and they don't age and all. But how and what does Botox do? So first of all, Botox is nothing but botulinum toxin, also called BONT, B-O-N-T, as in short form. It is a neurotoxin. That's why we have written it as B-O-N-T, botulinum B-O, and then neurotoxin, N-T. Okay, so uh, botulinum toxin is actually very potent and is considered to be poisonous as well. So it's a kind of poison as well. There are many antigenic types, like antigenically different toxins. So there are, if I elaborate, there are 8 types, starting from type A. Type A is the most common one and the one which we'll be using and studying about in facial aesthetics. However, there are A, B, then C1, C2, D, E, F, and G. So there are total 8 types of Botox. The ones which are commercially used mostly are A, then very rarely B, but not the other ones. So A is the one which we use even in facial aesthetics and is the one which we'll be talking about today. Okay, so this bond was actually discovered 2 centuries back. So it's not new. It's not something that has come up in the previous years. But how it was discovered and how it was named. Okay, today we'll not go into too much detail about the history, but still, there was a person who was eating sausages and he experienced the effects of botulinum toxin. So, sausage in Latin is called botul, B-O-T-U-L. Hence, he called this as botulinum because he ate it from a sausage and he experienced these, you can say, the symptoms like the effects of Botox. Hence, it was named botulinum toxin. But till then, it was not known what it is. We found out more about the toxin in 19th century than in the 20th century. But it was 1996 when it was actually described for being used in aesthetic medicine. So we are going to read about this. It was described like how you can use this in aesthetic medicine, but until 2002 it was not used. It was only described that you can use it for anti wrinkles or for removing the wrinkles. So first use was done in 2002, and that too for the you can say the wrinkles of forehead as well as glabella. So when you actually try to uh, show angry face, you see the lines over the glabella. They are called the glabellar wrinkles. So it was used for correcting the glabellar wrinkles, and that was the first documented use of Botox in aesthetic medicine in 2002. Okay, so I think that's sufficient about the history of botulinum toxin. I'll not go into details as I've already told you. Now we'll read very few basics about Botox. Today, see, we are going to discuss how to use Botox, and we'll even see a case, a real case, and we'll try to do a case so that you can understand how I take up a patient, and then how I plan a patient, then how I prepare a patient, and what do I do in a patient, and what are pre and post results of a Botox patient. Okay, so let's consider a patient to be patient X. So suppose this patient X comes to me, and patient has come to me for something which till now I don't know. Like patient has walked in into my clinic. Now how do I know whether he or she needs Botox? Like how to identify a patient which will require Botox and not fillers or threads or anything else. Okay, so for that we should know, okay, what all effect Botox has and what all we can do or we can treat with the help of this Botox or the botulinum toxin. Okay, for the rest of the lecture, I'll be calling it Botox instead of botulinum toxin. I find it easy to say so, that's why. So, first of all, I'll tell you what all parts or what all things you can correct with the help of Botox. It is very important. If you know what all we can treat with Botox, then you will be able to identify patients and select patients which may require Botox. So starting with forehead wrinkles. So people who have forehead wrinkles or the frowning lines which we say, then the glabellar wrinkles. Glabellar wrinkles are the ones near the glabella when you try to show angry face. Then the brow drooping. Some people may have very highly placed brow, or some people may have drooping arches. You can even correct that. Okay, then there's crow's feet. Crow's feet is the now some people might be knowing what is crow's feet. We have actually discussed it in the merge scale. So if you have not seen the second video, kindly go through the second and the first video. Then we have nasal wrinkles. Nasal wrinkles can be treated with Botox. Then we have the under eye wrinkle. Do not confuse the under eye wrinkle with the infra orbital hollow. Infraorbital hollow is different and under eye wrinkle is different. Okay, so this I'll write it as the upper face. This is what we can do in the upper face for the wrinkles. But other than wrinkles, there's one more thing that can be corrected in the upper face. See, Botox. Okay, we'll discuss what it will do and how it will do. Basically, it's relaxing the muscle. So wrinkles are going. Now, another thing which we can do is some people you must have seen have hyperactive temporal muscle or temporalis muscle. What happens is whenever they chew, you can see both the sides temporalis muscle hyperactivity. Even if they try to clench their teeth, you will see the hyperactivity. So even that visible effect that you can treat, the hyperactive temporalis muscle can be treated in the upper face with the help of Botox. Okay, now moving to the mid and the lower face, you will be surprised to know very effective treatment of gummy smile is Botox. You can correct gummy smile with the help of Botox. Obviously, if it is very severe, we can't without the help of surgery, but mild, even moderate cases can be corrected with the gummy smile. Then drooping of the nasal tip. You must have seen some people, nasal tip droops when they smile or they speak. Otherwise, it's normal. That's because of hyperactivity of which muscle? Okay, I'll leave it for you guys to comment below this video on the YouTube or over here, that which muscle is responsible for drooping of the nasal tip. Then we have neck wrinkles, and on the cheek, the pits, acne pits or the scar marks and the pits that might be of any degree. We can correct that with the help of Botox. Some people you must have seen specifically in the adolescent age as well as the adulthood having pits, and they want to get rid of those pits. That can be treated with the help of Botox. Then we have hyperactive masseter. Some people who have hyperactive masseter or hyperactive mentalis muscle, uh, that can also be treated with the help of Botox injection. Other than this, some people see, I've specifically given a pause at the 14th one. Till now, what we have done is all related to cosmesis, right? But there's something that can be treated with the help of Botox, which is very surprising for a few people because they must have not read about that. Cervical pain, neck pain, headaches, because of hyperactivities of muscles can be treated with the help of Botox. Like Botox in the trapezius can help in relieving a patient from chronic cervical pain, or injection in the occipitalis. So these are the uses other than aesthetics. Okay, so this is for lower face and the middle face. Now we know that what all can be treated with the help of Botox. So whenever you have a patient and you see a patient and you feel okay whether to use Botox over here or not, now you know where to use Botox and what for to use Botox. Now moving on. So consider that the patient has come to us now. Now the patient is in the clinic. So now I know what all things can be treated with the help of Botox. So I'm prepared. If the patient has come to me, I'll examine the patient. Now there are two things, two ways. First one, see, whenever a patient has come to you for cosmetic issue, the patient himself will give you a complaint. So patient might directly come to you and tell you that I have this problem and I want this problem to be corrected. For example, A patient may come to me for forehead wrinkles, frowning lines which have become permanent and are aggressive when he looks up. Or the other way around, patient may come to me for cosmetic issue only, but I will observe and tell him that his age, for example, if the patient has come to me for a younger looking skin, I can observe and tell him that your dynamic wrinkles are way too much and very severe, and if we treat them, then the overall appearance, youthful appearance, may have a better outcome. So, see, there are two things: patient will come with their complaint, or I will observe and advise them. Now, whatever I'll see is wrinkles. Now, wrinkles are of two types, either static or dynamic. Now, this is a very important concept, and you need to understand this that uh, static wrinkles, wrinkles which have become static, we will treat them with the help of fillers. Static wrinkles means like the forehead lines which have become permanent, very deep, or the uh, infraorbital hollow, or the nasolabial fold that has become very prominent, or the Marionette lines, and we will always leave them undercorrected. We will not overdo them so that the person looks artificial. We want the person to look natural. Then there are dynamic wrinkles, wrinkles which appear on doing some expression. They will be treated with the help of Botox, and this is very, very, very important. Your main aim should be to treat the dynamic wrinkles with the help of Botox. Automatically, your static wrinkles will also improve. That you'll understand once we start doing a patient. Okay, so we will not use Botox for only static wrinkles. We will not do that. So anywhere we will not use Botox where we do not know. Like for example, we will not leave a patient expressionless. I don't want a face where there are no expressions. Or we will not leave the patient with asymmetry or drooping of brow. We will not do anything wrong. Until unless we know how to inject Botox, we will not inject Botox. If we know how to do it correctly, then only touch it. Otherwise, do not touch it until unless you have done it under the supervision of someone with proper hands-on training. Otherwise, don't, because this Botox is very potent. Like, it has amazing power, and it can correct a face very, very easily. But also, you can make the person look bad if you do not know how to do it. So we'll learn it, and if you get a chance ever to learn it hands-on, then we'll try to do it, and then you can do it on patients. Okay, so till now what we have done, patient will come. I should know what all I can treat with the help of Botox. So now you know what all you can treat with the help of Botox. Now patient has come to the clinic. He has told me his complaints. I also observed the patient and I have told him, okay, this needs to be corrected. Now patient has agreed. Now I will give him a treatment plan. Suppose we are taking a case where we are treating only two things: forehead wrinkles, dynamic, as well as crow's feet. Only these two. So I'll now what I'll do, I've told my plan to the patient. This is what I'm correcting. Now I will take the history of the patient. Now you will be surprised, why are we taking the history? Why is the history important in Botox when we have already decided what we are going to do? Now this history is very important because there are some contraindications for Botox injections. Any person having neuromuscular junction disease or anomalies or anything related to that, any syndrome, for example myasthenia gravis, uh, then see, anything, Lambert-Eaton syndrome or myasthenia gravis, we will not touch the patient with the help of Botox, because Botox is going to act at the same junction, and already the people, they have muscle weakness. We cannot increase the muscle weakness, we will not enhance it, so we will leave the patient, we will not touch the patient with the Botox. Now, any injection has its uh, composition. Like, for making an injection, Botox is there, but there are some added constituents that help in making that mixture, like NaCl, albumin. So we have to check the components. Whichever brand of Botox you might get, check for the components and then ask the patient and take the history for allergy of each and every component. That has to be documented properly. We cannot go ahead with the patient without documenting allergy history of each component. Okay, then if everything is okay, we'll take the consent of the patient. We'll explain the patient about the outcomes. Now the outcomes, obviously, first of all, we have the favorable outcome which we want. to happen. So we'll tell the patient that these wrinkles will go, and we will tell him that static wrinkles will not go, the dynamic ones will go. Then we'll explain him the side effects. See, every drug can have a side effect. There are some effects which are immediate and are expected and are very very common, means they will occur in almost 8 out of 10 people which you have done. So you have to tell them that once I do the procedure, for 1 or 2 days you will feel this, you will feel that. So there are some very common ones, then there are some common ones, then there are the rare ones which are just like the warning signs which we'll discuss later, that if they occur you have to approach me. Okay, it does not usually happen, but still you have to tell each and every detail about it to the patient. Now our patient has understood the pros and cons, has like signed the consent. So he came to us, we examined him, we planned something that this is what we're gonna do. Then we took the history to rule out everything. We explained him everything. We took his consent. Now when we have taken his consent and explained him the details, now the thing comes. Now is the treatment issue. How to treat the patient. Now, before treating the patient, post procedure things also I'll explain him before. Now, post procedure effects also I've explained him. Now, I feel my patient is ready for undergoing the treatment. Now, I'll start with the treatment part. So, for the treatment part, what I'll do is I'll share with you an actual patient, which I had done once for Botox only, for upper facial Botox. I had done the complete upper facial Botox, but I'll only discuss about two things today. That is forehead wrinkles as well as the crow's feet. So this is the patient. I have already taken the consent from the patient, so no issues with the pictures and all. Okay. So first, let's revise everything what we had done in previous classes. Also, I'm marking the points. Trichion, glabella, then I'll mark the base of the nose, then I'll mark the chin or the now let's draw lines. We are just trying to see whether this matches what we had read last time about the golden ratio. Is this face also in that ratio zone or not? Okay, so I've marked the lines. Now see, I can see from here only that these are not equal, should have been equal. So I'm marking that, suppose that is A, this is B, and this is C. What I feel from my perspective over here is that out of these three, B is the biggest, followed by C, followed by A. So this person is not at all in the golden ratio. Golden ratio should have been 1 1 1. If we are considering it, see, length to width, I am not considering it. I am just taking the uh, division. These three parts should have been almost equal, but they are not equal in this case. Okay, so moving on, let's draw other lines also. You remember we had discussed a line, vertical line, passing from the medial canthus to the outer edge of the ala. So outer edge of the ala is here. Medial canthus you can see is inside. So this line is little bit shifted. So it's not where it should have been. Like vertically in the same plane, they should have been the medial canthus and the ala. So you can say the nose is broad. Here it should have been technically. So it's broad. And now the other line from the medial margin of the cornea to the oral cavity corners both side. Now you can see their ratio also will not come proper, because you can see already over here the inner part should have been here. Had it been here, the ala, this face, the nose at least would have been in a perfect ratio with the lips, but right now it's not. Okay, the other two from the lateral canthus, they are equal. The lateral canthus, the distance from the lateral canthus to the medial canthus and the intercanthal distance, they appear to be equal. So, okay, let's not deviate from what we were discussing and go back to Botox. I thought it'll be good if we revise it for once at least. Now, coming to Botox and the MERS scale, we had discussed the MERS scale. Now, this is the MERS scale for forehead lines at rest. Now, look carefully at rest. From here, I don't know how good is the quality of the video to you. Actually, there are very mild lines, but there are. You might not be able to appreciate the lines, and you might feel that this is grade 0, but I am writing it as grade 1. Static. They are static lines. Lines at rest. They are not at the expression. we are not talking about the dynamic lines. Now see, when I've asked him to look up, now you can see there appears some lines on his forehead. Now these are dynamic lines. When you ask the patient to see up, look up, move his brows up, now these lines you can link to either grade 3 or 4 based on your perception. Different people choose different perceptions and different grades. I'll take it as MERS 3. So I'm taking it as the MERS 3 in dynamic phase. So dynamic lines of his forehead are MERS scale 3 as per me. Now coming to the crow's feet. Crow's feet again at rest. First I'm talking about the crow's feet at rest. Now if you see on left and right side, both sides they're almost nil, but I'll call it as on the right I'll give it 0, on the left I'll give it 1. They're very fine lines, but there are, so grade 0 and 1 for the MERS scale of crow's feet. So this side is 0, this side it's still 1, but not less than 1 in static. Now you see the dynamic lines. Here you see, if you see his nasolabial fold, you'll see he's smiling in this. And now you see these lines over here. These lines show that there is severe, like grade 3. You can even call it grade 4, but at least grade 3. There is grade 3 wrinkles on his crow's feet while smiling. So dynamic lines again on the forehead also grade 3 or grade 3 4, whatever you want to choose. Here also grade 3. Grade 3 lines are there and you can see it. So actually I think you will be able to appreciate the difference between static and dynamic more once I show you the video. So even for the forehead frowning as well as the crow's feet, what I'll do is I'll show you a video. So whenever a patient comes, we take pictures, then we take a video, and we take video and pictures from both the sides, front and side. Front for the forehead, side for crow's feet. Why we take a video? So that we can show that we are asking the patient to actually do an expression, so that muscles come into action. Now you see here I'm asking him to look up. When he's looking up, see, when he's not looking up there are no lines. When he's looking up there are severe lines, grade 3. Now here also you see the crow's feet. Previously in the static area there were no crow's feet, but when he's smiling there are grade 3 wrinkles in the crow's feet area. So now I'll show the picture and we'll compare it to the actual MERS scale, exact that picture. Okay, so before doing that I'll tell you again what we did was, the patient came to us, we examined the patient. So the patient had come to me, I had examined my patient, then I had explained him everything and compared MERS scale, like where he was matching. Then I took a picture of dynamic as well as static and compared it again. Then I recorded a video which I showed you right now. Now I have documented all this. Now I'll document individual picture with individual picture from the MERS scale. Here his picture dynamically is matching this picture from severe lines from the dynamic MERS scale, or the expression face of the forehead. Okay, now see, I'll document this. I'll document MERS scale for dynamic forehead lines to be grade 3. Now I've documented it with one picture and I've written pre. So these are the pre pictures from the treatment. So treatment has not started yet. These are pre pictures or pre procedure pictures. Now I'll document similarly the crow's feet area. Now in this you can see on the left crow's feet of this person while smiling, that is dynamic crow's feet. Now to confirm whether the person is smiling, see the nasolabial fold on the both sides and you'll understand the person is smiling. Even on the picture in the comparative picture which we have taken from the MERS scale, even in the patient's picture, the smiling lines are present, so we know that this is a dynamic picture. Here you can see the crow's feet area. They are of grade 3 severe wrinkles. Some people might find it equivalent to very severe or grade 4, but I feel grade 3. So I'm marking it as dynamic lines in the crow's feet area from MERS scale as grade 3 again. So see, I have marked it grade 3 in both dynamic lines on the forehead as well as dynamic lines on the crow's feet area, and both are pre-procedure pictures. Till now we have only seen pre-procedure pictures. Now what we have done or what we have marked till now, see how to mark also you'll understand when you make a file of the patient. MERS scale you'll write forehead, you'll write static and dynamic. Then again what I'll do, I'll write crow's feet. Again what I'll do, I'll write crow's feet, static and dynamic. Now, one very important thing, see, for crow's feet, there are two sides, right and left. What you can do is, you can mark individually. You can either do this, like you can write bilateral crow's feet, or you can write right and left. So what I prefer doing is, I write left and right over here only, like right and left, so that uh, it's easy to understand instead of writing bilateral. So forehead static for this patient was 1, forehead dynamic for this patient was 3. Crow's feet static was 0 on one side and 1 on the other side. Then crow's feet dynamic on both sides is 3. So Merck scale I have already documented. Now what I'll do is, I'll proceed with the treatment. So for proceeding with the treatment, first we should know all about Botox, which we are already knowing by now. So for treatment, we should know how to inject, where to inject, what to inject. So right now, I'll tell you the injection points where all we inject Botox. Where do we inject Botox on the face? But the dosage, the units, everything I'll not discuss right now. That we'll discuss later, because that is not of much use for you right now. For you, the most important thing for now will be where to inject and how to inject, dosage and units, and how to calculate and how to mix the Botox, how it comes, what's the preparation, that can be discussed later. So to start with, uh, the injection points for the forehead, we are doing the injection points for the forehead first. First, I'll tell you about the forehead, then we'll move on to the crow's feet area. So for the forehead, I'll draw, these are the eyebrows I'm drawing. So the brows, then I'll draw the eyes. Yeah, so these are the eyes. Now what we'll do is, okay, let me make the nose so that you have an idea. Now what I'll do is, uh, this is the face, overall face of a person, that is the hairline, and this is the side contour. So this is, suppose a female comes to us for uh, forehead wrinkles. What I've done is, I've imagine I have taken a pen, yellow pen, and I'm marking the shape of the brow. So I've marked the shapes of the brow. You can see that. Now from the highest point of the brow on both the sides, I'll mark a perpendicular line, a straight line, vertical line till the hair margin. Now this line usually passes through the mid pupillary line, but can be otherwise as well. So I prefer taking the line which goes from the topmost point of the brow. Now on this line I will leave 2 centimeter area. I'll measure 2 centimeter area and I'll leave it. Now I'll make a line, horizontal plane line at this point, connecting these 2 points. Now anything below this line I will not touch for the forehead wrinkles. I can touch it for the glabella and other things, but not for the forehead. For forehead wrinkles, any injection I'll give above this side. So now what I've done is, I've divided it into 4 first and then into 8 equal parts, the upper area. Now this upper area I have divided into 8 equal parts. I'll use the midline to extend on both the sides for 1 centimeter along with the face contour and mark another 2 points. Now this is what you have to draw. Now I'll mark the points on this. This is the drawing. Now I'll tell you where are the injection points. Just see and learn why are they here, that will not discuss abhi. Okay, so let's start. Uh, I'll mark the points exactly where we have to inject, where we are injecting the Botox. In the center of the squares, in the center 4 squares, the points are in the center. On the lateral squares, the points are on the boundary, and then these 2 points which we had marked. These red marked points are the points of the injection, where we'll give the injections. Everywhere we'll give 2 units of Botox. Now what units, how to calculate that I'll tell you later. But this point, this point, this point, so how many? 2 2 2 6, then 2 8, then to 10, then again 2 2 2 2 2, then total 20. So 20 units you can actually put here. Understood? And now see, very important thing I'll tell you. What happens is, imagine uh, in this face, on one side, right side, that is, imagine that I give 2 units each on the right side. Okay, to relax the muscle. So what Botox is doing actually, it is relaxing the muscle, so the wrinkles are not there. The muscles will not contract as much as they used to. Now imagine on right side I've done 2 units on all points, but on left side what I do is I give one unit. Now this creates imbalance. The muscles on the right side are relaxed more, but the pull on the left side muscles is more because they are not relaxed. Right side they are relaxed, left side they are not relaxed. This brow goes a bit up as compared to the other one. So that is where this thing comes into play. Now similarly, this asymmetry we can use even for beautification. Now imagine these two lateral points, I give only 1 unit or even 0 unit, and in the center everywhere I've given 2 units. What happens is the central part of the brows stay down because the muscles, the frontalis is relaxed completely, but the pull on the sides is increased. So if previously this was the shape of the brow, suppose, now the pull on the lateral side is increased equally on both sides. You can give arch to the brow, an artificial arch, like it will look 100% natural, you will not even come to know, but eyebrows will be naturally arched, and this is what we call as the foxy eyes. You can create foxy eyes with the help of Botox. And that's just like, once you learn what we are doing and once you master this thing, you'll understand where, if you reduce 1% or 1 unit, how this change will occur and how the patient will look. Okay, so I'll simplify it again, I'll draw it again. These are the brows. On the topmost point till the hair margin we draw 2 lines, we leave 2 centimeter, we create another line, put a line in the center, again divide into 4, then put a line again over here. And now what I have done is extend the middle line 1 centimeter and then mark the points. So the 8 points where we are giving the Botox in the center are these: 1 2 3 4 5 6 7 and 8, and the 2 on the sides. Okay, 2 units each. This is Botox of the forehead. So this is for the Botox of the forehead. Now you've seen it in the drawings. Let's see it on a real patient. How to draw it, where to be present if the patient is lying down. You have to be present behind the head. Patient has to lie down in front of you. So I'm marking the brow. Now on the highest points, from both the highest points, I'll mark a vertical line towards the hair margin. I'll leave 2 centimeter space, mark another line. Then I'll divide that into two. Again, center line, divide into 8 equal boxes. Now I'll mark the points in the center of the last line, then in the center of the boxes, then again on the line. Now I'll extend this middle line by 1 centimeter following the contour of the face on both the sides. Okay, this side and this side, both sides, and mark another point. So these are the 12 points. Oh, sorry, 10 points. 8 in the center and 2 on both sides, uh, including both sides. So this is Botox for forehead. Now let's see the marking for the crow's feet. So first of all, you should know that for crow's feet, I'm taking the side view. That is the brow. This is the eye. I've made the eye. Now this is approximately where the crow's feet is actually present. So what I'll do is first palpate the outer orbital rim with your tip of the finger. Now palpate the outer orbital rim. Suppose the outer orbital rim comes somewhere here. I'll draw it. Suppose somewhere here when you are feeling it. Exactly 1 centimeter you leave. 1 centimeter distance. From 1 centimeter distance, you mark a point horizontally parallel to that. Mark another point above and below, forming an arc, which is approximately 1 centimeter away from that center point, forming a sort of radius. Now this should be the direction of injection, and these three should be the points. Now I'll show you in a simplified, magnified way. So here, if this is the outer orbital rim, 1 centimeter away is the first point where I have marked. Now make an arc of 1 centimeter, 1 point above, 1 point below. This is how the first injection will go. This is how the second injection will go. This is how the third injection will go, forming an arrowhead. You can see an arrowhead going away from the eye if that is the outer orbital rim. Now see, these injections have to be superficial. We cannot go deep here. They are superficial injections. Here we give 3 units at all 3 points. Whereas where what we read before, the forehead, the injections are always given in the muscle. We try to go in the muscle. Here we try to stay as superficial as possible. Okay, so these are the real markings. You can see markings on the forehead. as well as the marking on the for the crow's feet. You can see this, and the direction of the injection also I've made. Okay, moving forward, now I've given the injection. So post treatment, post procedure, just see the crow's feet area, pre and post. This is on day 2. Now let me tell you, the actual result of Botox comes after 7 to 14 days. Best result comes. See, in both the cases, patient is smiling, and just look at the dynamic lines of the crow's feet. From 3 they have gone to 1, or you can say even 0. So the crow's feet area, which was Merz scale 3, just look at the wrinkles over there, the dynamic wrinkles. Here he is only smiling, but on the post phase, I've asked him to laugh with the face open. Still, there are no lines, and this was day 2. Now, this is the picture of day 7, post treatment day 7. The patient came up for follow up again for day 7. So, you have to call the patient on day 2, day 7, and day 14. Now, just have a look at this area. There are literally no lines. This place has become blank when he's smiling. He's still smiling. You cannot make it out, maybe because of the mustache. It's not there. I'll show you a video and you'll be able to appreciate it better over there. So first, forehead. This was the pre-video. We had already seen it. You can see approximately severe lines were coming here. You can see. Now post. Only 1 or 2 lines are remaining. That too over the left eye. That's also because this is day 2 or day 7. And complete effect has not come. Now you see the crow's feet area. This is the dynamic wrinkles in the crow's feet which were coming pre-treatment, and post-treatment you see when he is smiling, there is literally no wrinkle. Merz scale 0 from Merz scale 3. Now you see from Merz scale 3 it has come to Merz scale 0. So that is the power of Botox. Botox is very powerful. Now we'll compare it with the pictures. Best thing, how to show the patient that your treatment has worked. Take a picture of pre and post treatment, make a collage, and keep it with the Merz scale pictures, the respective pictures of the respective scales. So severe wrinkles in the dynamic phase pre-treatment. However, this can even be considered 4. In the picture it's 3, but if you try to see, it's even more than the picture of the Merz scale. Then post treatment, if you try to see, it is 0. Literally there are no wrinkles. So it's like Merz scale 3 or 4 to Merz scale 0. We have brought the patient to 0. And if you want to consider it even 1, then also see from 3 to 1, and from 3 to 2, then 2 to 1, and 1 to 0. Patient has come to 0 in 7 days with the help of Botox injection. And this is why now he is looking youthful. Previously, the patient's age was not much. Patient is unmarried. His age is less. But because of these wrinkles, the skin looks a bit elder, like aged, but the patient is not. So to bring back the youthful skin, we can do this. Now this effect will last at least for 6 months, and can even last till 18 months depending on how your body will metabolize the Botox. So that is dependent, that varies from person to person, like how your body takes on the Botox. So today we have done, till now what we have read is about the Botox, like its history, its like how it was discovered, where it was used first, then how to see and know where to use Botox, what are the uses, so which all patients we can treat. So we know all the uses of Botox. Today we have seen a patient where we have discussed the forehead and crow's feet area of the patient, where we have what are the points where we have given the injections. So that I am again showing. This is what we have done till now. Now we have also seen how to prepare the patient, how to examine, how to take consent, then how to take proper history for this, and to note down the allergies as well. Then we have also seen where to mark for the injection. Now remember this, marking is very important. Before proceeding with the procedure, mark the patient. Even if, like, I have done more than, I'll say, 40-45 patients for this, but even today I mark all my cases. You have to mark the cases. Until unless you'll mark, see, there's no point of making a mistake if I can mark, and it hardly takes 5 minutes. So do not forget to draw the markings. Okay, for the next class, what I'll do is we'll do markings for few more things of Botox. We'll complete the Botox. Today we did only 2 things, that is forehead and the crow's feet. We'll do markings of the other uses of the Botox, where to do. Then some of the side effects also we'll discuss. Then I'll try to start with the fillers next class, so that we are on the track and we can finish off this series early. We'll try to do fillers. We'll start with the fillers and we'll do the treatment of the fillers. We'll start individual part wise, the filler part. And for all the people, I'll say, if there are PGs who are interested in doing the MCQs, uh, there are more than 900 MCQs and illustrations on the ENT surgeons on Instagram. If you want to follow, you can find the ENT surgeons, or you can just Google ENT by Dr. Pranshu Mehta, and you'll find a few articles, some videos, and some questions that might be useful for you. So, well, that's all for today. I am Dr. Pranshu Mehta, and this is Aesthetic Medicine and Injectables, Lecture 3. Hope to see you soon next week for the Lecture 4. Till then, keep reading, keep learning.